All right, this is the multi-segmental extension test. We're going to use this test for this case primarily just to look at hip extension. So we need to see how much our hip flexors lengthen, okay? What you'll notice is I have some tape here on my ASIS. If I was to take my hands like this in a C shape and put them around my hips here, you would notice that the front part here, I can feel this big bony prominence, okay? That's going to be my ASIS. That's going to be something that we're going to look for in the hips here. So what we're going to do is I'm going to ask you, I'm going to look to the side here. And what I want you to see is as I bend backwards, does this beige tape go past my toes? Can I get my hip to go past my toes? Okay. If it does, that would be a pass test. That tells me I have good hip flexor length. If I'm short, that tells me I don't. Okay. The other things in this test too, I'll just point out are, do I have enough upper spine? So from my belly button to my collarbone, thoracic spine extension. Does my shoulder blade, there's a part called the spine here, does it come past my heels here? Does it come past my heels? That's a good sign. The other thing I want to look at is, do I get a lot of uniform curve? Like, do I get this nice, like reverse C shape in the spine? I probably won't. You're going to probably notice that I'm very straight and I'm really bendy in my low back, which might not be a good sign. And couple that with this lack of hip extension is no good. That's a recipe for back pain. So enough talking, let's show it. I'm going to have you just stand here like this, cross here, feet underneath the hips, okay? Feet right underneath the hips directly. Here, I'm going to cross and I'm going to extend, and that is no good. Exactly what I said. Do my hips, so my ASIS clear my toes? Heck no. Do I see a uniform curve? Absolutely not. Do my shoulder blades get past my heels? Absolutely. But I'm bending on my low back. So I'm a perfect example for recipe for disaster for potentially back pain because of lack of hip extension and then lack of like thoracic extension. So if you were able to bring your hips past your toes, that's a pass test.